Tell me about yourself.
I'm a highly motivated and compassionate individual with a strong desire to contribute to the well-being of others, which is why I'm so drawn to the role of a nursing assistant. I've always been interested in healthcare, and I find immense satisfaction in providing direct, hands-on care to patients. My background includes completing a certified nursing assistant program at Community College of Healthcare, where I excelled in both the theoretical and practical components. I also completed a 120-hour clinical rotation at Sunshine Nursing Home, where I gained valuable experience assisting elderly residents with their daily activities. Furthermore, I volunteered for 6 months at Mercy Hospital in their rehabilitation unit, assisting with patient transport and providing support to the nursing staff. I'm a naturally empathetic person, and I believe this quality is essential for building trust and rapport with patients. I'm also very detail-oriented and organized, which allows me to effectively manage tasks and prioritize patient needs. I understand the importance of clear communication and teamwork in a healthcare setting, and I'm committed to collaborating with other healthcare professionals to provide the best possible care. I'm a quick learner and I'm eager to continue developing my skills and knowledge in this field. I am also very reliable and understand the importance of punctuality and dependability in the medical field. I am looking for a position where I can make a meaningful difference in the lives of patients and contribute to a positive and supportive healthcare environment.
Why did you choose to become a nursing assistant?
My decision to become a nursing assistant stems from a deep-seated desire to provide compassionate care and make a tangible difference in the lives of others. I've always been drawn to roles where I can offer direct support and assistance, and the nursing assistant profession perfectly aligns with this inclination. Observing the dedication and empathy of healthcare professionals, particularly nursing assistants, during personal experiences with family members in medical settings solidified my aspiration. I witnessed firsthand the crucial role they play in patient comfort and well-being, not just in terms of physical care, but also in offering emotional support and fostering a sense of dignity. The ability to directly contribute to someone's quality of life, especially during vulnerable moments, is incredibly rewarding to me. Furthermore, I appreciate the practical, hands-on nature of the work. I enjoy the opportunity to learn and apply essential skills, such as assisting with activities of daily living, monitoring vital signs, and ensuring patient safety. The prospect of continuously developing my knowledge and expertise in a dynamic healthcare environment is both exciting and motivating. Ultimately, I chose this career path because I believe that every individual deserves compassionate and respectful care, and I am committed to providing that level of support to those in need. I am driven by the intrinsic satisfaction of knowing that I can positively impact the lives of patients and contribute to their overall well-being.
Why do you want to work for our facility?
I am particularly drawn to your facility due to its established reputation for providing exceptional patient-centered care and its commitment to fostering a supportive and collaborative work environment. From my research, I've noted your dedication to utilizing innovative approaches in patient care, which aligns with my own desire to continually learn and improve within the healthcare field. Furthermore, I was impressed by your facility's emphasis on creating a positive and respectful atmosphere for both patients and staff, a value that resonates deeply with me. During my investigation into your organization, I was particularly interested in your specific programs for long-term care, which demonstrates a dedication to the holistic well-being of residents. I am eager to contribute my skills and compassion to a team that prioritizes patient dignity and quality of life. The values your facility upholds, coupled with the opportunity to work alongside experienced professionals, makes this an ideal environment for me to further develop my career as a nursing assistant and to make a meaningful difference in the lives of your patients.
What are your strengths and weaknesses?
One of my key strengths is my inherent sense of empathy and compassion. I genuinely care about the well-being of others, and I believe this translates into providing attentive and supportive patient care. I am also a highly reliable and dependable individual. I understand the importance of punctuality and consistency in a healthcare setting, and I am committed to fulfilling my responsibilities to the best of my ability. Furthermore, I possess strong communication skills, which are essential for effectively interacting with patients, their families, and fellow healthcare professionals. I am adept at listening attentively, conveying information clearly, and fostering a positive and respectful rapport. My ability to remain calm and composed under pressure is another strength that allows me to handle stressful situations with grace and efficiency. I am also very good at following directions and procedures. Regarding weaknesses, I recognize that I am relatively early in my career as a nursing assistant, and I am still building my experience in certain areas. While I am eager to learn and grow, I sometimes find myself needing to seek clarification or guidance from more experienced colleagues. To address this, I actively seek opportunities for professional development and mentorship, and I am committed to continuously expanding my knowledge and skills. I am also sometimes overly critical of my own performance, and can be a bit of a perfectionist. I am working on being more accepting of my own learning process, and to celebrate the small victories as I gain experience.
Can you describe your experience with patient care and the specific tasks you have performed?
In my experience with patient care, I've developed a strong foundation in providing essential support and assistance to individuals with diverse needs. I've consistently focused on delivering care that prioritizes patient dignity, comfort, and safety. Specifically, I've gained proficiency in assisting with activities of daily living, or ADLs, which include bathing, dressing, grooming, and toileting. I understand the importance of respecting patient preferences and promoting independence while providing these services. I've also had extensive experience in monitoring and recording vital signs, such as temperature, blood pressure, pulse, and respiration. I am meticulous in my approach to these tasks, recognizing the significance of accurate and timely data collection for patient assessment and care planning. Additionally, I've assisted with patient mobility, including transferring patients from beds to wheelchairs, assisting with ambulation, and ensuring proper body mechanics to prevent injury. I am well versed in the use of assistive devices, such as walkers and canes, and I understand the importance of creating a safe and supportive environment for patients with mobility limitations. Furthermore, I've provided nutritional support by assisting with meal preparation and feeding, ensuring that patients receive adequate nourishment and hydration. I've also gained experience in providing emotional support and companionship, recognizing the importance of addressing the psychosocial needs of patients. I understand that active listening, empathy, and a compassionate demeanor are essential for building trust and rapport. I've also provided post-operative care, including monitoring patients for complications, assisting with wound care, and ensuring patient comfort. I've also assisted with infection control protocols, and know the importance of hand hygiene. All of these experiences have equipped me with the practical skills and compassionate approach necessary to provide high-quality patient care.
How do you ensure patient safety?
Ensuring patient safety is my absolute top priority, and I approach this responsibility with meticulous attention to detail and a proactive mindset. I understand that patient safety is a multifaceted concept, encompassing both physical and emotional well-being. Firstly, I adhere strictly to infection control protocols, including thorough hand hygiene, proper use of personal protective equipment, and meticulous cleaning and disinfection of equipment and surfaces. I recognize the importance of preventing the spread of infections, especially in a healthcare setting. Secondly, I prioritize safe patient handling and mobility. I am trained in proper lifting and transfer techniques, and I utilize assistive devices appropriately to minimize the risk of falls and injuries. I am always mindful of patient limitations and needs, and I communicate effectively with them to ensure their comfort and safety during movement. Thirdly, I am vigilant in monitoring patients for any signs of distress or changes in their condition. I pay close attention to vital signs, observe for any adverse reactions to medications or treatments, and report any concerns to the supervising nurse promptly. I understand that early detection and intervention are crucial for preventing complications. Fourthly, I maintain a safe and organized environment, ensuring that patient rooms and common areas are free of clutter and hazards. I am also mindful of patient privacy and confidentiality, recognizing the importance of protecting their personal information. Furthermore, I am committed to continuous learning and staying up to date on best practices in patient safety. I attend training sessions and workshops to enhance my knowledge and skills, and I am always open to feedback and suggestions for improvement. Finally, I believe that effective communication is essential for ensuring patient safety. I communicate clearly and respectfully with patients, their families, and fellow healthcare professionals, fostering a collaborative and supportive environment. I understand that open communication is key to preventing errors and promoting positive patient outcomes.
How would you handle a difficult patient?
Handling a difficult patient requires a combination of patience, empathy, and effective communication. My approach focuses on de-escalating the situation, understanding the underlying cause of the patient's behavior, and providing compassionate care. First and foremost, I would remain calm and composed, avoiding any actions or words that could further agitate the patient. I would approach the patient with a gentle and reassuring tone, maintaining eye contact and demonstrating active listening. I would strive to create a safe and non-threatening environment, ensuring that the patient feels heard and understood. I would actively listen to the patient's concerns, allowing them to express their feelings without interruption. I would validate their emotions, acknowledging their frustration or distress, and avoid dismissing their concerns. I would seek to identify the underlying cause of the patient's difficult behavior. Often, patients act out due to pain, fear, confusion, or unmet needs. By understanding the root cause, I can better address their concerns and provide appropriate support. I would then attempt to redirect the patient's attention, engaging them in a calming activity or conversation. I would use clear and concise language, avoiding jargon or technical terms that could confuse the patient. If the patient's behavior poses a threat to themselves or others, I would immediately notify the supervising nurse or other appropriate healthcare professionals. I understand the importance of seeking assistance when necessary, and I am not afraid to ask for help. I would document the patient's behavior, including the specific actions taken and the patient's response. This documentation is crucial for ensuring continuity of care and providing valuable information to other healthcare professionals. Throughout the interaction, I would maintain a professional and respectful demeanor, treating the patient with dignity and compassion. I understand that difficult behavior is often a manifestation of underlying distress, and I am committed to providing the best possible care, even in challenging situations.
What would you do if a patient refuses care?
If a patient refuses care, my primary response would be to prioritize understanding the reason behind their refusal. I recognize that patients have the right to make informed decisions about their own care, and it's essential to respect their autonomy. I would begin by calmly and respectfully engaging with the patient, attempting to create a safe and open space for them to express their concerns. I would ask open-ended questions to encourage them to elaborate on why they are refusing the care, actively listening to their responses without judgment. It's crucial to differentiate between a temporary reluctance and a firm, informed refusal. If the patient expresses concerns related to pain, discomfort, or fear, I would address those concerns directly, offering reassurance and exploring alternative approaches to care. I would explain the benefits of the care being offered, and the potential risks of refusing it, in clear and simple terms, ensuring they understand the implications of their decision. If the refusal stems from a misunderstanding or lack of information, I would provide accurate and comprehensive education about the procedure or treatment, addressing any misconceptions they may have. I would also make sure that they understand that they have the right to refuse care. If, after a thorough discussion, the patient continues to refuse care, I would respect their decision. However, I would also immediately inform the supervising nurse or other appropriate healthcare professional, documenting the patient's refusal and the reasons provided. I understand that it is important to communicate the refusal to the rest of the team. I would also document everything that was discussed with the patient, and any steps that were taken. I would continue to monitor the patient's condition and provide alternative forms of support, such as emotional comfort or assistance with other aspects of their care, as appropriate. I would also be sure to continue to treat the patient with respect and dignity, regardless of their decision.
How do you prioritize your tasks when caring for multiple patients?
When caring for multiple patients, effective prioritization is crucial for ensuring that everyone receives timely and appropriate care. I approach this responsibility with a systematic and organized approach, focusing on the most urgent and essential tasks first. My initial step involves assessing the immediate needs of each patient, considering factors such as their medical condition, current symptoms, and any scheduled procedures or treatments. I prioritize tasks based on their urgency and potential impact on patient safety. For example, I would immediately address any patient experiencing acute distress or requiring urgent medical attention. I also take into account any time-sensitive tasks, such as administering medications or monitoring vital signs, ensuring that these are completed within the designated timeframe. I understand the importance of following the care plan established by the supervising nurse, and I use this as a guide for prioritizing tasks. I also communicate regularly with the nurse and other healthcare professionals to ensure that everyone is aware of the patient's needs and any changes in their condition. I strive to be proactive in anticipating potential needs and addressing them before they escalate. For instance, I would proactively assist patients with toileting or hydration to prevent falls or dehydration. I am adept at multitasking and managing my time effectively. I use a system of organizing tasks, such as creating a mental checklist or using a written planner, to ensure that I stay on track and complete all necessary tasks. I understand the importance of flexibility and adaptability. I am prepared to adjust my priorities as needed, based on changes in patient conditions or unexpected events. I am also aware of the importance of clear communication with the patients, so they feel that they are being seen, and that their needs are being met. Finally, I understand that teamwork is essential for effective patient care. I collaborate with other healthcare professionals to ensure that tasks are distributed efficiently and that patients receive comprehensive care. I am always willing to assist my colleagues and offer support when needed.
Tell me about a time you had to handle a stressful situation.
A particularly stressful situation arose during a shift when I was caring for multiple patients, and one patient, Mrs. Johnson, began experiencing a sudden and significant drop in her oxygen saturation levels. Mrs. Johnson, who had chronic obstructive pulmonary disease, COPD, was normally stable. However, during my routine check, I noticed she was becoming increasingly agitated and her oxygen saturation had plummeted. This occurred while I was also assisting another patient with their meal and another was requesting assistance to the bathroom. Compounding the issue, the supervising nurse was assisting another patient in a critical situation and was unable to immediately assist. My primary task was to stabilize Mrs. Johnson's oxygen levels while simultaneously ensuring the other patient's needs were met and to alert the supervising nurse as soon as possible. I immediately prioritized Mrs. Johnson's situation. I first ensured she was in a comfortable, upright position to maximize her lung capacity. I then increased her supplemental oxygen flow rate, as per her prescribed parameters. While doing this, I spoke to her in a calm and reassuring voice to help alleviate her anxiety, as I knew anxiety would worsen her breathing. I then quickly checked on the patient requesting the bathroom, and asked them if they could wait a moment, and assured them that I would be right back. I then let the patient eating know that I would be back as soon as I could. I then immediately alerted the supervising nurse, explaining the situation clearly and concisely. While waiting for the nurse, I continued to monitor Mrs. Johnson's vital signs and oxygen saturation, providing reassurance and comfort. The supervising nurse arrived promptly, and we worked together to further stabilize Mrs. Johnson. Her oxygen saturation levels gradually improved, and she became more comfortable. The other patients were also attended to in a timely manner. The supervising nurse commended my quick thinking and calm demeanor during a stressful situation, and emphasized the importance of clear communication and prioritization. This experience reinforced my ability to remain composed and effective under pressure, and to effectively prioritize patient needs in a fast-paced environment. It also reinforced that clear communication is key in a medical environment.
Describe a time you had to work as part of a team.
During my clinical rotations, I had the opportunity to work as part of a multidisciplinary team caring for a patient recovering from a complex surgical procedure. This experience highlighted the importance of teamwork and effective communication in providing comprehensive patient care. The patient, Mr. Rodriguez, required a coordinated approach involving nurses, physical therapists, occupational therapists, and physicians. My specific role was to assist with his daily care, including monitoring his vital signs, assisting with hygiene, and supporting his mobility. The team met daily to discuss Mr. Rodriguez's progress and adjust his care plan accordingly. During these meetings, I actively participated by sharing my observations and contributing to the discussion. For example, I noticed that Mr. Rodriguez was experiencing increased discomfort during physical therapy sessions. I communicated this observation to the physical therapist, who then adjusted the exercise regimen to minimize his pain. I also worked closely with the occupational therapist to assist Mr. Rodriguez with activities of daily living, such as dressing and eating. We collaborated to develop strategies that would help him regain his independence. Furthermore, I consistently communicated with the nurses regarding Mr. Rodriguez's vital signs, medication administration, and any changes in his condition. This ensured that everyone was on the same page and that his care was coordinated seamlessly. One particularly challenging situation arose when Mr. Rodriguez experienced a sudden drop in blood pressure during a physical therapy session. The team responded quickly and efficiently, with each member taking on specific roles to stabilize his condition. I assisted by monitoring his vital signs and providing emotional support, while the nurses administered medications and the physical therapist adjusted his positioning. The team's coordinated efforts resulted in Mr. Rodriguez's rapid stabilization. This experience reinforced the importance of clear communication, collaboration, and mutual support in a healthcare setting. I learned that by working together as a team, we can provide more effective and comprehensive care to our patients. It also solidified my understanding that each member of the team, regardless of their role, plays a vital part in the patient's recovery.
Give an example of a time you provided excellent patient care.
There was a time when I was assigned to care for Mrs. Evans, an elderly patient who had recently been admitted for a hip fracture. She was understandably anxious, not only about her physical condition but also about being away from her home and family. Beyond the typical tasks of assisting with her hygiene and mobility, I felt it was crucial to address her emotional well-being. I made it a point to spend extra time with Mrs. Evans, engaging in conversations about her life, her family, and her interests. I discovered she was a passionate gardener, and this became a frequent topic of our conversations. I brought in a few potted herbs from the hospital garden, which brightened her room and sparked fond memories for her. I also noticed she was missing her daily newspaper, so I made sure to get her a copy each morning. One afternoon, she was particularly distressed, expressing fears about her recovery and her ability to return home. I sat with her, listened attentively, and offered words of encouragement. I also contacted her daughter, who was unable to visit that day, and arranged for a video call. Seeing her daughter's face and hearing her voice significantly lifted Mrs. Evans' spirits. Throughout her stay, I consistently went beyond the basic requirements of my role, focusing on building a genuine connection with Mrs. Evans and providing personalized care. I noticed that she enjoyed a particular type of tea, so I made sure she always had it available. When she was discharged, her daughter specifically thanked me for the extra care and attention I had provided, stating that I had made a significant difference in her mother's recovery. Mrs. Evans herself expressed her gratitude, saying that I had made her feel like a person, not just a patient. That experience reinforced my belief that excellent patient care extends beyond physical tasks and involves addressing the emotional and social needs of each individual.
How do you handle conflict with coworkers?
When faced with conflict with a coworker, my primary approach is to address the issue directly and professionally, aiming for a resolution that benefits both parties and maintains a positive work environment. I believe open and honest communication is crucial in resolving conflicts effectively. First, I would seek to understand the other person's perspective, actively listening to their concerns and trying to see the situation from their point of view. I would avoid making assumptions and instead ask clarifying questions to ensure I fully understand the issue. If possible, I would address the conflict privately, away from patients and other staff members. This allows for a more open and comfortable discussion. I would express my concerns respectfully, focusing on the specific behaviors or actions that caused the conflict, rather than making personal attacks. I would use "I" statements to express my feelings and avoid placing blame. For example, instead of saying, "You always do this," I would say, "I felt concerned when this happened." I would strive to find common ground and work collaboratively to find a solution that addresses both our concerns. I believe compromise is often necessary in resolving conflicts, and I am willing to be flexible and open to different perspectives. If we are unable to reach a resolution on our own, would seek assistance from a supervisor or manager to mediate the situation. I understand the importance of maintaining a harmonious work environment, and I am committed to resolving conflicts in a constructive and professional manner. I also understand that sometimes conflict arises from misunderstanding, and that clarifying expectations or procedures can solve many issues. I would also try to ensure that after a conflict is resolved, that I maintain a professional relationship with the coworker, and avoid holding grudges.